In this presentation, we will learn about the different types of treatment options that are available for alcohol or drug use, and share the first step in getting help. There are 5 main types of treatment: outpatient, intensive outpatient, also called IOP, partial hospitalization, sometimes called PHP, residential treatment, and inpatient treatment. A medical provider helps to determine the best type of treatment for a particular patient. If detox is needed, it is helpful to know that detox can be effective in any of the treatment settings. MAT, which stands for medication-assisted treatment, can also be delivered in any treatment setting. A lot of times, people who need help aren't sure where to begin. The first step in getting help is an assessment. An assessment is a friendly interview between the person who needs treatment and a counselor or nurse. This interview can happen in person or over the phone. During an assessment, a person who needs help works together with a counselor or nurse to figure out which type of treatment best meets their needs. The first type of treatment is outpatient. Outpatient treatment can be staffed by counselors or other healthcare professionals and may include group counseling, individual counseling, or both. A person receiving outpatient treatment does not spend the night and typically receives between 1 hour to a few hours of treatment each week. The second type of treatment is intensive outpatient, also called IOP. IOP treatment can be staffed by counselors and sometimes other healthcare professionals. IOP includes group counseling and, at times, also individual counseling. In intensive outpatient treatment, a person does not spend the night but typically receives treatment several hours a day for several days a week. Many IOPs meet 3 days a week at the same time each day, either in the morning, afternoon, or evening. The next treatment type is called partial hospitalization. Like outpatient and intensive outpatient, partial hospitalization can be staffed by counselors and sometimes other healthcare professionals. Partial hospitalization includes group counseling and sometimes individual counseling and other services. In partial hospitalization treatment, a person does not spend the night but typically receives treatment 20 or more hours each week. Compared to outpatient or intensive outpatient treatment, partial hospitalization is usually for people with more health and mental health needs. The fourth type of treatment is residential treatment. Residential treatment can also be staffed by counselors and sometimes other healthcare professionals. Residential treatment includes group counseling and also can include individual counseling and other services. People in residential treatment do spend the night and typically spend 24 hours a day, 7 days a week in this type of treatment setting. The final type of treatment is inpatient treatment. Inpatient treatment is staffed by healthcare professionals and may include individual or group counseling as well. Inpatient treatment is for people who require 24-hour-a-day medical care. The person sleeps here and gets treatment. People detoxing from alcohol or benzodiazepines, such as Xanax, Valium, or Ativan, or people with complex health problems may need inpatient treatment. A doctor helps to figure out if inpatient treatment is needed. After or during treatment, some people find it helpful to live in a place that does not allow alcohol or drug misuse. A sober house is a place to live and sleep where no alcohol or drug misuse is allowed. There are usually meetings or other supports to encourage recovery. The website drughelp.care can be used to find each type of treatment. You can type drughelp.care into the web browser on your computer, tablet, or phone. To find available treatment services, click the blue Treatment Services button. Drughelp.care provides a number of different search filters to help find the type of treatment you need. You can expand the menu that says Treatment Services to find all the types of treatment we just talked about. Click on the type of service you are looking for. Remember, the first step of treatment is an assessment. For more information about how to use the drughelp.care website, click here.